Hi, my name is George Leibowitz. I'm professor of social work at the Stony Brook School of Social Welfare, where I've been for the last year. I've been a social work educator and clinician for a number of years. Going on 20 years now, I've been working in a variety of settings that impact juveniles, in justice settings, in criminal justice, substance abuse programs, and health-related kinds of work. I found forensic social work very compelling early on in my career. In fact, I draw back from the early experiences when I started working for a residential program, and everyone can appreciate the chaos of kids being placed in environments often with very little structure themselves or guidance. As an early clinician, I recall how important it was to develop a sense about what would be good evidence-based practices, what would be best practices working with kids with complex trauma histories who are far away from their families and so on. So I became very attracted to family work, or integrating family work into practice with young people, and which lent itself very nicely to doing work that involved kids involved in the justice system at that point. So as the field and my work evolved, I sort of talk about myself anyway as a clinician, researcher, practitioner, that it's very difficult to think of research not having a place in practice or helping inform practice in some way. So I've often valued the integration of both of those things, which I feel forensic social work does and lends itself very nicely to doing. So currently I am collecting data and have worked a lot with kids across the country on a variety of issues impacting their family life, their health, their well-being, and so on, and continue to also teach in these areas.